Hi there. Let's talk about one of the many vulnerable population groups that we can be addressing in public health. There are many more than the four that I've highlighted for this week's module, but one of them that is very important is the population that we often refer to as LGBTQIA plus. And basically, these are people who don't prescribe to gender or sexual orientation norms and can often experience devastating results with their mental and physical health because of these things. And oftentimes it's the healthcare system that's to blame. And so that is why this population is such an important one to discuss. So as with all of my lecture videos, I'm going to talk about a few things in more detail, but the rest I expect for you to go over on your own with the lecture slides. These are things that are probably known to you, but it's important to be clear that there is a major difference between sex, gender, and sexual orientation. Sex is our biological characteristics. Gender is a social or cultural characteristic. They do not always go hand in hand. A big debate that has been happening for quite a while now is the idea that is sex binary or is it on a continuum? And actually science is beginning to tell us a whole lot about even sex, the biological characteristics that make up whether you are considered male or female are actually there's much grayer areas in there, and it's not a binary. It's not just your XX or XY, but there are a lot of chromosomal differentiation that occurs in utero that determines the extent to which you are male or female, and there's a lot of minute differences within there. The estimate is that 1 in 100 births are with people who do not have standard male or female biological characteristics. 1 in 100, and that's probably bigger than we recognize. So there are a lot of people walking around who may not prescribe to those norms, and we think they do. There's more common abnormalities with sex chromosomes, Turner syndrome and Klinefelter syndrome. Please click on these links here where you can just briefly look at what the syndromes are if you're not familiar with them, and then see, you can look and see at the rates of these conditions. Intersex is the term that we use now. The old term was hermaphrodite. That is definitely not an appropriate term anymore. So intersex is the term we use for anyone who is born with atypical sexual or reproductive anatomy. And again, I gave you the statistic. About one in 100 are born as what we consider intersex. There's some great resources if you click this link here that can teach you more about what that means and the statistics with that. And then the World Health Organization has some wonderful guidelines and recommendations on what to do when babies are born intersex. And there's quite a hot debate right now. World Health Organization seems to be leaning more in the direction of lean towards raising these babies as female and doing surgical procedures to help them become more female with their anatomy. But psychological research doesn't necessarily back that up. So I invite you to explore that in more detail on the World Health Organization website. As with sex, we also have to ask, is gender binary, or are there things in the middle between what we consider masculine and feminine, man and woman, that people can ascribe to? So I have a list here that I'd like for you to explore. This does not encompass all of the different types of genders that people can ascribe to. This link here actually shows Tinder, the popular dating app, has 37 gender identity options, and there's actually even more than that out there, but that might be interesting and helpful for you to peruse because you want to become familiar with these different gender identities the more and more that we are able to see people ascribing as such in a healthcare setting. Cisgender is an important term to know. Cisgender is what people call themselves when their identified gender matches the sex that they had at birth. So the majority of us would call ourselves cis or cisgender, but a lot of people do not fall under that category. And so these are some of the ways that they differentiate. Sexual orientation, again, is distinct from sex and from gender. And you can have a romantic or sexual attraction to a lot of different gender identities. And so that's kind of what I have listed for you here. My work in working with teens in mental health capacities is that there were a lot of teens who were really exploring all of these different sexual orientations and identities. And some of the younger ones would say, well, I'm just asexual. And I often ask them to explore, is that perhaps because your sexuality has not fully bloomed yet? And so in some cases, it's a developmental thing. And in other cases, it may be just the way that they were born and wired. The American Psychological Association here has some great resources, again, for helping people to explore what they might do if they are thinking that they're identifying in an atypical sexual orientation or gender identity, and how to find proper resources and how to come out to loved ones. This graphic is excellent. I advise you to pause the video and take some time to really explore this graphic. This is something that I was introduced to when I worked at Sharp Mesa Vista, and one of the trainings that we were given really helps us kind of break down what's the difference between gender identity. So how is a person saying that they identify? How do they think of themselves? Their expression may be different. I often, in my capacity with teens and mental health, worked with teens who would identify as a masculine person, but would dress much more feminine. Or the reverse. I can think of one person who was born biologically male, but identified as female, changed her name from a him, changed pronouns from him to her, changed the name, and then, but then still dressed in a very masculine way. And so you wouldn't have known just by looking at this person that they now identified as a she and with a female gender identity. So these things are different, and everybody chooses to express the way that they think about themselves differently. And then their orientation sexually can not be what we would expect as well. So all of this just goes to show there's a continuum in a lot of settings and a lot of characteristics, and it's so, so important to get to know our patients individually and ask them good questions. This is just a smattering of the health impacts of sexuality and gender. I have you reading a brief article this week that goes into a little more of these statistics, but this is staggering that almost half of youth who identify as transgender have attempted suicide. And as you can see, that is 10 times beyond that of the general population. This is staggering. They're 2 to 3 times more likely to suffer from depression and anxiety. 3/4 of them report experiencing harassment at school. Please click on this link here. The Trevor Project is an outstanding national organization dedicated to issues with LGBTQ youth, and they have some excellent statistics from a recent national survey that they did on mental health with transgender youth. Pretty powerful statistics. And then something that also weighs into this debate is the fact that now in our current DSM-5, so this is our diagnostic manual for psychiatric disorders, gender dysphoria is now a diagnosis. This was adapted, or this was, the latest edition came out in 2013. And so for the last 6-7 years now, we are actually able to diagnose someone who is experiencing great impairment mentally and emotionally due to their gender identity. So it's not anyone who has decided to become transgender, but people who are experiencing major impairments in their life because of the internal turmoil with their gender identity. This can be helpful and this can be harmful. The diagnosis can be helpful because it can allow for more services to be rendered and reimbursed, but it can be harmful because it can be an additional label or stigma on someone who is wrestling with their own gender identity. So why are these students at greater risk? 3 major reasons: social isolation, lack of parental or caregiver support. I saw that very often working with teens, and harmful norms. Just feeling like they're out of place, which is something that teens already commonly experience, and this just puts them at even more risk for falling outside of those norms, which then leads to social isolation, bullying, harassment, etc. This is a video that I have linked for you in our Canvas as well. It's a 10-minute video. It's really, really important that you watch this and learn about how this relates specifically to healthcare providers, why we need to know these things about our patients. And what we can do: 3 things. We can offer a safe space, we can assess, we can ask good questions, and we can explore with our clients the ways that their gender identity and their sexual orientation affect all the different aspects of their health, because this is all encompassing. So I have all of this listed here for you. And then lastly, I'd really encourage you to click on this link, Each Mind Matters. It's a California mental health movement, and this document here is called Be True and Be You, and it just has excellent resources, not for the healthcare provider, but for you to offer clients, especially LGBTQ youth who are struggling with how to come out and how to respond to the bullying and the stigma, et cetera. Just wonderful, wonderful resources.